Welcome to Business Connection. I'm Liz Spencer. Today we're on site at the Edward Cancer Center with their administrative director and one of their medical oncologists to learn about their expansion plans and their innovative approach to cancer care. It seems like there's always construction someplace, but there's construction here, but it's good construction.
It is, absolutely. So we opened the Naperville Cancer Center in 2005. We started with 3 medical oncologists. By 2009, we actually opened our Plainfield Cancer Center to accommodate the rapid growth of patients from the far south and western suburbs. Today, in 2015, 10 years later, we have 7 medical oncologists. We've added 3 surgical oncologists. We have 6 nurse practitioners and 4 radiation oncologists. So, boy, have we grown, and we need more space, definitely.
So tell me a little bit about what you're doing.
Right now what we're doing is actually working on expanding our exam room space because, as I mentioned, we have so many more providers that need room to see these patients. So we are actually in the process of moving our physicians out of their offices. They might not be very happy about that. And actually converting their offices into exam rooms so that we can actually see patients right there. And right now the location of where the physician offices is perfect because we actually hold our multidisciplinary conferences right there next to the physician offices, and that way now we'll actually be able to see the patients and the physicians can see them right there next door, so it's going to be very nice. We're excited about that. But we'll also be adding 2 additional rooms in our infusion area. We're going to add actually 2 rooms with beds in them to accommodate patients who are here for 4, 5, 6 hours and really want to be able to lay down. So we're adding 2 of those rooms, and we're also just looking at enhancing the overall look of the cancer center. We've actually went out and talked to our patients and got their thoughts on it, and they agree it's time for a makeover.
So one of the areas that has been really enhanced lately is surgical oncology.
About 2.5 years ago, we decided to add a surgical oncologist, Dr. George Salty. And this was really because we were sending patients downtown for these complex cancers. So a surgical oncologist actually does surgery on complex cancers that require a certain expertise. So Dr. Salty joined us, and he's brought some really innovative procedures and technology. One of them being HIPEC, it's called, and it's actually hyperthermic intraperitoneal chemotherapy. HIPEC is for cancers that are in the peritoneal surface that may have come from the GI tract or gastrointestinal tract, or it's often a gynecological cancer such as ovarian. And in the surgery, it's like an 8-hour surgery, so it's long, but they actually bathe the abdominal cavity in chemotherapy, heated chemotherapy. And this actually allows the chemotherapy to penetrate the tissue, and you can give a much higher dose, but it does not have a systemic effect that you would get if you gave it actually into the vein. So it's less side effects, and actually has been shown to actually increase survival rates with these cancers. So that's been fantastic. Also in the fall of 2014, we added NanoKnife. And this is actually irreversible electroporation technology, and this is most often used with stage 3 pancreatic cancers, which actually, prior to this technology, there was no surgery for these cancers. And in this, they actually put needles on each side of the tumor, and they send high voltage pulses through it that actually cause holes in that tumor cell, and it can no longer live. And so we've actually been using that procedure, like I said, on the stage 3 pancreatic cancers, and it is a new and innovative procedure, so we're hoping there will be more tumor sites that we'll be able to use it for. But this actually gives patients that previously didn't feel there was a surgical hope that ability to actually have this surgery at Dr. Salty. And we did had a partner for him here just in July, Dr. Shake, and he actually is just getting off the ground, but really Dr. Salty, again, has seen rapid growth, and to accommodate him to be able to do these lengthy surgeries, he needed a partner. So we did add him along with Dr. Gressick, who is a breast surgeon, fellowship trained here at the Cancer Center. So we just continue to grow our services for the community and for what the patients need in this area.
One of the neat things, we're going to get a chance to talk with one of your oncologists about your multidisciplinary conferences or clinics.
Yes.
A feature of the Edward Cancer Center is this multidisciplinary clinic. Can you tell me a little bit about that?
Multidisciplinary clinics are clinics that involve different specialists, and they incorporate those specialists into a single patient care team. So, for example, we have different clinics for different cancers. We have clinics for breast cancers, gastrointestinal cancers, neurological cancers, as well as thoracic oncology. I am actually a member of the Multidisciplinary Thoracic Oncology Clinic here at Edward. It was the first clinic that was formed here at Edward and the first of its kind in the DuPage County area. In this clinic, we have different specialists, which include thoracic surgeons, medical oncologists such as myself, radiation oncologists, as well as pulmonologists, radiologists, pathologists, and social work, nutrition, as well as oncologic nursing. And so with that, with different specialists on board, we're able to provide a very comprehensive and coordinated care for the patient.
Sounds like quite a big team.
It is a very big team. As you know, the treatments for cancers nowadays are increasingly complex, and a lot of times we require multiple treatments, combination treatments, just to offer the best treatment for the patient's cancer. So sometimes, for example, for lung cancer, the person will need surgery as well as chemotherapy and radiation therapy. And so we have all those specialists on board in that one clinic under one roof, that the patient can see all those different specialists all at the same time during the same day.
Well, I think that probably eases a lot of stress in an already very stressful situation.
Absolutely. And what it does do as well is it helps facilitate, instead of having to see the different specialists in different days, requiring different appointments, you see all the specialists in one day. And that definitely helps in terms of the anxiety and expedites treatment and the workup.
Well, and I imagine it helps communication too.
Yeah, so we have the different specialists on board, and we discuss each patient's case. Every specialist then, actively participates in patient care and contributes valuable information that is incorporated into the patient's care plan.
And how does this all come together to benefit the patient?
The point person is the nurse navigator. Usually that's the first person that the patient or the family are in contact with. They call the clinic to set up the appointment. The nurse navigator then helps navigate through that confusing process of having this diagnosis, and then setting up appointments, obtaining records, imaging, and all that. And then once they come to the clinic for their first appointment, the patient also has that opportunity to meet with social work as well as our patient counselors. They're able to provide practical information as well as provide emotional support and resource information. And then during that clinic day, one of the members of the multidisciplinary team will meet with the patient, obtain the history, do a physical exam, and then gets to present that patient's case to the team in a conference. During that time, review all the patient's films, pathology reports. We do have a very lively discussion because, of course, there are different specialists involved, and then come up with a care plan for the patient. So after the conference, that physician then goes back, talks to the patient and the family about the treatment plan, whether additional studies are needed, and if they need to meet other specialists, as part of their treatment plan, they have a chance to meet all the specialists at that same day, that same appointment.
And that big clinic day kind of sets in motion and begins their treatment. So
Correct.
And so hopefully ending in a very positive note.
Yes, and we follow them through the entire process and through recovery as well.
Well, it sounds like a great approach. Thanks for taking time to explain it.
Thank you very much.
We've talked a lot about the growth and the growth of the center, but it makes me wonder, is cancer growing?
It has, and again, just because of the aging population, our baby boomers, and also increase in survival rates due to more effective therapies and early detection. We actually have a comprehensive program around early detection and screening. Right now we actually have breast aware, lung aware, and we are soon to be starting a new initiative called colon aware. Right on our website, you can actually go to these aware programs, breast aware, lung aware, colon aware, and you can take an assessment to see what your risk is. And at the end, it will actually, if you are high risk, it will prompt you to have a visit with us, and actually an oncology nurse navigator will call that patient and actually follow up and see what it is that they need. So really, again, early detection is what we're trying to do. We want to catch cancers earlier, if indeed that's the problem. Or if it's not, we want to see, do you have a genetic, should you get genetic testing? Is there something else? Or do we need to help you with maybe being overweight? Is there something that we can help that will actually decrease your risk for cancer? So we're really trying to reach out to the community and make it more about health and wellness and prevention.
That's awesome. Well, let's hope for that outreach, and that we'll see cancer become much more manageable, if not eliminated in the future.
Absolutely. I hope so. Yes.
We'll be right back with more Business Connection.